And in honor of Dry Eye Awareness Month, as a Dry Institute, we wanted to work together as a team and not only increase awareness, but also meet together tonight and increase education so we could all learn together. And I spent a little bit of time trying to figure out what's the title for something like this. And not very elaborate, but I thought it's Dry Eyes in all of us, meaning all of us as a team, individually and collectively, we all work together to learn more about dry eyes, how we can help your symptoms, help you feel better, treat the signs. Maybe you know Dr. Befrus, sure great journey with him, and been there about 1.5 years now. Great work with him. And the rest of the team, man, these people probably look familiar to you. You know, they're wearing masks. That's our team, Michael here and Leslie and Aldana. And then we are really excited to welcome Dr. Amandeep Brar. She's our new ocular disease resident. She just graduated from Maui School of Optometry, and there's a small percentage of doctors going to do residencies through optometry school. So she's one of them. We're really glad to have her and part of the program. Hopefully we'll be able to meet her and work with her in the dry clinic and Center for Sight Side in different settings. So we're glad to have her. Well, we hope this will be a great discussion tonight. My plan is to talk a little bit about dry eyes, give an overview, and then spend the rest of the time for a good question and answer period. Like I said, we're trying to increase awareness, but at the same time, as we increase awareness, increase education so we can all learn together. Michael, you might be able to see if people have questions. Maybe you can kind of help monitor that for me too.
Sure.
Okay, thank you. Michael just thought he was joining in, but now he's doing IT and question answer and everything else. So job description gets bigger. Great. So we'll go and get started here. You know, a lot of times with dry eyes, many patients may not know if they have dry eyes. There's common symptoms for dry eyes. Some common symptoms we hear that we may not recognize readily. Sometimes patients might just talk about fluctuating vision, where they have to keep blinking to get it clearer. Or for example, after they've been reading for a while, it's harder to focus. They have to rest their eyes and put down the book for a while to get it clear again. That could be a sign of dry eyes. It's a dysfunctional tear syndrome. Sometimes more common, you might hear it's burning or tired. Not necessarily common dry symptoms, but they just feel tired. They feel better when they're closed, for example. Patients may talk about gritty or grainy, and that's usually what we commonly think about for dry eyes. Well, if it feels gritty or grainy, it's more likely dry, but sometimes the other ones may not be as noticeable for that. Another one is going to be watery eyes. And it may sound backwards, but sometimes if our eyes get so dry, as a reflex, they may water. So these are all common symptoms of dry eyes. Now, when patients describe those symptoms, we try to find any signs that correlate to them. Some common signs of it can just be a slow dysfunctional tear syndrome where the tears start to break up quicker than we'd like. And we'll show you some pictures of that. Sometimes it might show a little bit of dryness down here at the bottom. That might feel that burning and tired where the patients just feel like they want to have their eyes closed. It can be really gritty or grainy feeling where the surface isn't smooth and it just feels like there's something in it all the time, foreign body sensation. And it can be pretty severe, and the eye is so sensitive, and a little bit of dryness can really be irritating for the patient. And then sometimes it can be so severe that it not only affects the comfort, but also the vision. It might water as a reflex. I'm getting one other patient on who wanted to join, so there we go, good. Yep. So these are different dry symptoms and dry signs. And as I said, we're trying to increase awareness of this, so we'll talk about some of these and how they interconnect. I think when it comes to dry eyes, there's a few different areas that we try to look for to try to treat. Sometimes dry eyes can be due to low tear quality. So the quality isn't as good as it could be or should be. Decreased tear quantity. We don't have enough of the good tears we do need. Maybe decreased eyelid closure or blinking. Maybe there's some exposure component. We'll talk briefly about that, show you some pictures. Maybe the surface of the eye just isn't smooth for whatever reasons due to corneal dystrophies or just aging changes. And all this leads ultimately, unfortunately, as many patients know, decreased comfort, decreased vision, and quality of life. And really, if our eyes are so dry, it does affect our quality of life. And as a team with Dry Institute, Michael and I and the rest of our team, we try really hard to look at these different areas and ways that we can improve these different areas to hopefully increase your comfort, increase your vision, quality of life. Michael, anything you want to jump in on this so far with some introductory slides?
Well, I think the biggest thing that we have seen over the last 2 decades of doing dry eye has been the patient's awareness, because it is multifactorial and it is impacting the quality of their life. So patients are extremely astute as to those subtle changes that slowly increase. And we're excited that we can get patients into the clinic earlier on in the disease process, where we can do much more than historically when we had less opportunity to help them if they came in later in the process.
Yeah, I think that's a great point. And really, we can actually we have better options to treat nowadays. So that's great. We can diagnose it earlier and treat it better. Yeah, thanks, Michael. Let me just go through these few subheadings there. We'll talk about decreased tear quality. And I think there's two things that can cause decreased tear quality. Maybe there's debris buildup along our eyelashes or blocked glands. And these are just different pictures of different eyelashes, maybe a spectrum of so mild debris buildup. And as they go along, that debris buildup gets a little more significant. And you can see what happens as we get more and more debris buildup. We kind of get this waxy coat on the eyelid margin, kind of get these blood vessels start to develop, some underlying low-grade inflammation. That's more of a severe. And many times we have patients with styes. So sometimes we'll have patients with styes with come in like this, very common condition of stye, kind of a painful red tender area on the eyelid. And these are findings that we know that don't happen overnight, but there's been some sort of gradual blockage over the months or years, maybe due to debris buildup. There's the microbial buildup, block glands, and over time, it blocks the glands and leads to infection. So we really feel like this is one step, one condition that can cause decreased tear quality. Here's a picture of someone who has something like that, some significant eyelid buildup. And we did a cleaning in the office and it looked like that. So this would be similar to if you go to the dentist, get a good cleaning. You know, you brush your teeth at home, you get a lot of it, the plaque off, but sometimes it's still not enough. And we're going to need to go to the dentist to get a good cleaning and have it all removed. And similar to our teeth, when they're clean, they just work better. And that's what we found with this patient here. Show you a picture of how that process works. This is not that patient, but basically Michael, Aldana, Leslie, one of our team members, use a soft, high-speed brush, and they brush right along the eyelid margin. So basically they're just removing all that perfectly, completely. As a result, we have this nice clean approach. And we do one eyelid at a time. They numb the eye, doesn't affect the vision. This is really a painless, brief, effective treatment for treating this underlying blepharitis. By doing that, as I mentioned, when things are cleaner, they just work better. That gives us better tear quality. We also find that not only does it improve the eyelid health, reduces the risk of styes, helps the eyelashes look healthier, grow better, but also helps prevent blockage along the glands. And that's another reason for low tear quality. So sometimes our glands get so clogged where the oils, the natural oils within the glands don't squeeze out like they should. These are, again, patients from our clinic where we take pictures, and what we're trying to do is help squeeze out these oils. We have maybe 25 to 30 glands along our eyelid, and they produce this outer oily layer of our tear film. That outer oily layer protects it, so it helps keep our vision stable. But if these oils don't come out like they should, we don't have that protective layer. So here's some examples of some of the oils coming out a little bit here, maybe a little bit there, but ideally it should come out as oil. This almost looks more like toothpaste-like quality. Sometimes it's a little bit softer, more like buttery, but I do want it to be oily as they come out. And even better, when we blink, the oil should come out easier. So here's some examples of that expression, as we call it. Many times when we see in the clinic, we'll press on your eyelid just to see how much and how well these oils express out. Sometimes we push on, there's no expression at all. We just get the glands that have been blocked and we can't get any of the oils to come out. So in addition to cleaning the eyelids for that debris buildup, we also feel like it's important to get a better idea to find out, well, how much gland blockage is there? How many glands does the patient have? How well are they working? So we do a procedure called lip review, and many of you have had this done. It's basically kind of like to use a dental analogy again, how dentists might use an X-ray to examine our teeth, check for cavities. This is similar. This is like an X-ray of the eyelid. It's a gland scan. It's called meibography. And this is really a great scan. Our meibomian glands, like I said, there's about 25 to 30 of them. Should look like long white columns. I might tell patients they should look like piano keys, long white evenly spaced columns. And ideally, the oils come out through here every time we blink to feed the tear film, to protect the tear film. Sometimes though, from aging changes or debris buildup, chronic inflammation, we start to lose some of them. Maybe they get a little bit narrower, a little bit shorter. Some are actually missing. This is from a patient who had a sty due to some gland blockage. I think it's important to reemphasize that when we get styes, it's not something that happened overnight, literally. I mean, it may seem like that, but it's been due to some underlying gland blockage down here that's predisposes the patient to that condition. I'm going to show you a spectrum. So this is a top picture of a normal myelography, early narrowing or shortening, early loss. We're going to keep going through, and some, as you can see, these glands get narrower, shorter. We're just having more gaps in between them. They get shorter yet. A few more slides. And unfortunately, these glands have all scarred down. All we just have left is just a small area of glands. And sometimes all we have is maybe one or two. Unfortunately, we can only count them. Or unfortunately, none at all, except for just a few up to the side. So myelography is really helpful to us as a dry eye team to find out how many glands the patient has and how well they might be working. The reason that's important in the real world is this means that if we don't have the oils in our tear film, we have what's called a rapid tear breakup time. I'll show you an example of that. So this is a patient who has a normal looking surface. This is a nice distribution of tears. But about 5 seconds later, you see these little dark spots showing up. So basically we had the patient blink and they asked them to hold their eyes wide open, try not to blink. And this is what happens. So about 4 or 5 seconds later, these dark spots show up. And that's just because the oils from our glands down here aren't coming out as well. They're not protecting the tear film as well. So the tears are breaking up quicker. And this will cause that fluctuating vision. This is why you might notice you have to keep blinking to get it clear, for example. Or you might have to put down your book after reading for 5 or 10 minutes because it's gotten blurry. We have this tear dysfunctional component to this meibomian gland obstruction.
Austin?
Yes, Michael, please jump in.
Forgive this interruption. Did you want to take questions as they come in, or did you want to wait towards the end? We have a couple of questions in now.
Let's go and look at this. Great question from some of our patients there. One question is, how often is the in-office lash cleaning needed? And so that's a good question. If I can go back to that dental analogy, every 6 months for some patients, needed every 6 months to clean off that debris. It might be due to their environment, their skin type, their ability to clean them off themselves. So a combination of factors, but we have some patients who come in every 6 months and take care of it. Now there's some really great nowadays, some home therapy that we can do to clean them off. And that complements what we try to do in the office. Similar to going home and brushing your teeth. Instead we go home and clean your eyelids. Sometimes we still need to have that brushed off. And as an extension of that, once it's cleaner, that helps the eyelid surface be cleaner. The other question the patient asks us is really great, is once we've lost those glands, can we get them back? And unfortunately, the answer is no. It's irreversible. We can't get the glands back. Now, what we can do is we can help the glands work better. And I'll show you a picture of that. So aside from causing that dysfunctional tear syndrome, here's what happens with dry eyes. See, it's sad. We don't want the sad tear leg like that. So when it happens, if we can do, actually, I'll go back a second. So what we try to do is we try to improve that tear quality. If we can get the glands working, the eyes feel better. So to answer your question, we don't get the glands back, but we can do is help the ones you do have work better. And that many times a good set of glands really can help keep the surface nice and smooth and stable tears. Mark, you want to add anything to that?
No, I think you covered it nicely. I think one of the things that is appreciative is the instant feedback from the patients when their tear starts to get reconstructed and their quality of life improves as the quality of the tear improves.
Yep. It's nice they feel better. It's kind of like when you leave the dentist or brush your teeth, you just feel better. So whether it's the cleaning or the heating, both are helpful for it. And lid wipes can help. Another patient's asking a question here, we can do some good home therapy, kind of like toothbrush and toothpaste would help. Clean off this area here. So that helps some. It just may not get it all off. And it's similar to like going to the dentist to get the rest of the plaque off. So great question for that too. These are great questions. Thank you for your comment. Ask the question, does Fuchs dystrophy cause dry eyes? I'm going to bring that up in just a minute. That's a really good question as far as eye health goes. But hopefully this gives you an overview of what we're looking at so far. So perfect for those. So low tear quality, to kind of review, can be due to ocular surface health, this debris buildup. It can be due to gland blockage. And we best assess the glands by doing what's called mammography. And Michael and I and the dry team really feel like this is so important to make sure we have a good understanding for dry eyes that basically this is a process. You look into this monitor and in a few seconds, the machine looks at the glands and then we're able to assess the glands. And then as a provider, we always review these gland scans with you so we know exactly where we're starting, what you have, and what our goals are. We feel like this is so important. So next time you're in the office, we'll do a complimentary gland scan. So if you use this code word, so it's mammography. Maybe you might be able to remember a gland scan easier, but next time you come in the office, let us do this for you. It's, we'd like to provide that as a free service, complimentary service, so we can get a better idea of the glands and see how well they might be working. And then we can also find out what the best treatment options are. So when you come in for your dry evaluation, let's help with that. We're happy to do that for you and make that part of the process for you. So the gland scan sure is helpful to give us good views there. So when we see this gland blockage, we want to improve the expression, we want to jumpstart it. One way of doing that is by using some in-office advanced light therapy options. And it's usually a two-part procedure. Sometimes we'll just do a healing red mask like we see on the right-hand side here. Sometimes we'll pair it with a intense pulse light therapy. And I'll just show you briefly what happens. Patient wears the goggles. The team member does the light therapy. And they have a bright pulse of light that targets the blood vessels, reduces inflammation, heats up the oils, helps oils come out better. And we do it throughout on both sides of the face, on either side there. After or before, the order doesn't necessarily matter, but we'll do a healing red light. We put this red light on that further heats up the glands, more than just a heat mask at home. It has this light energy that actually helps modify the tissue. So I feel like this is a really great pair to help the glands work better, jumpstart what we're trying to do for us. Michael, you're kind of the star there, although we only see our hands and arms. What can you tell us about IPL?
Well, one, it's just a wonderful technology because it does two things at the same time on a metabolic level. So it tries to reset the gland function, and the patients are appreciative of this over their course of sessions, usually 3 sessions, sometimes a 4th. Every 2 weeks, they start to appreciate the evolution of the comfort of their tears. The patients process when they're having either the IPL on the left or the red mask on the right is really a comfortable environment. The part on the left with the IPL only takes about 40-45 seconds. The part on the right, which is very relaxing, takes about 15 minutes to do. The patient experience is positive. The outcomes are incredibly predictable. The diagnostic tools that we have to make sure we're doing the right procedure on the right patient really helps us refine our therapeutic approach. So we really enjoy doing this for patients because the feedback and the clinical outcomes is so good.
Michael, one of the attendees asked, is the mask hot? Do the light pulses hurt?
Good questions. So the light pulses do not hurt. I will tell you on your first session, the very first pulse, your goggles are on and your eyes are closed. And the expectation is by the patient that they're not going to see much. But we remind them that The first pulse can be a little startling because you have a bright light more than you anticipated. Not discomfort, but a little startling. And after the first pulse, the balance of the pulses are uneventful for the patient. The red mask, the red light that emanates from that white mask on the right, the mask never warms up. The way the energy affects the anatomy is it generates warmth of about 9 degrees warmer than your body temperature on your eyelids. So it's quite comforting. We have a percentage of patients who just fall asleep during the process. The procedure only takes 15 minutes, but the mask itself doesn't create facial warmth. It's the body and the anatomical response to the energy that's being delivered by the mask that creates internal warmth in the lid. And that's therefore much more effective at helping the glands reduce inflammation and increase the lubricity of the oil.
Yeah, I think that's key to reduce inflammation. Inflammation anywhere in the body isn't good. So if we can reduce that inflammation, that helps the glands work better on a microscopic level. Michael, do you notice the patients fall asleep after you put the mask on or after you start talking to them?
Mostly when I'm talking to them.
So maybe that's what it is, huh?
Mm-hmm.
It's very therapeutic. You can tell me anything. It's a therapy session. So it is really nice. Patients like that. It's a great experience for that. That's a great question for it. I have another question about patients. I've always been dry using Petaday. Let me jump to that question just a minute after I finish this section here. I love these comments. This is so helpful. So basically, we try to improve the tear quality. What that does, it gives us better tear. And this is my only slide of the deck. I'll go fast through it, but I just read this article earlier this week. If you like reading papers like this is a really good article and a summary slide. And it basically describes what Michael mentioned. With IPL, we're able to decrease the bacterial load on the eyelids. We increase those oils that we talked about, softens it, melts it, helps it dissolve. We give us a better tear quality. We decrease the inflammation, this abnormal vasculature along the eyelid. And actually helps the cells grow, helps regenerate and help them work better, kind of jumpstarts them. And as a result, the end result of this is the dry eye disease, the symptoms are improved. Now, this is just a slide, a scientific slide of it, but let me show you a few patients that in fact, one I saw today to show you the difference. I'd love to see these before and after pictures. So here's a patient with a fair amount of meibomian gland dysfunction or obstruction. This is of the right eye, and actually you can see the oils come out. That's pretty good. But it's not very clear. It's kind of cloudy. You can kind of see these red blood vessels. That's low-grade inflammation. Of their left eye, though, a lot of inflammation. That's called telangiectasia or ocular rosacea. And sometimes if there's a lot of this inflammation surrounding the glands, it kind of makes them harder to work as well. And as a result, what happens is the oils just don't come out as well. So it's almost like toothpaste. And if that's with me pushing on it, we know it's not coming out naturally just with our normal blinking. So here's a patient before IPL, having symptoms of watering, burning, fluctuating vision. We did a IPL round. I think we did 3 or 4 sessions. And here's what it looks like. I'll show you this here. Oh, excuse me. And so the bottom picture is the oils, see before the cloudy, are a lot clearer. And there's less inflammation. The oils up here, which were barely coming out, just like toothpaste, are starting to come out oily and a lot clearer. So patient felt a lot better. So I showed you a scientific slide, but this is a real life example. And then here's one that happened today. I thought it was really good. Fair amount of inflammation, gland blockage, and I couldn't get any of the oils to come out. And I think we had a 3 or 4 IPL session, and here's how the patient was doing today. Much better. See the clear oils coming out, less inflammation, importantly, and that helps to give us better tear quality. Now, sometimes patients, after they get a base of 3 or 4 IPL sessions, that may be all they'll need, and we can just touch it up again in 6 months or a year. Sometimes patients might need additional testing or additional treatment more frequently. But if we can catch it early enough, we can really get some good improvement and help the tear quality. Have some questions coming in here. Mike, you want to talk about Bruder mass? That kind of goes along with yours. That's a great question about Bruder mass and nutritional supplements. This is all the tear quality part of it.
Sure. So both are helpful. I think patients really appreciate the fact that they can control a lot of their well-being at home, and something simple like mindful of nutrition and hydration is really important. So the supplements are very helpful for people who don't have a fair amount of fish oil in their natural diet. The fish oil will lower the inflammation systemically and help the eyes feel better as well. The Brutta mask is a simple task for a patient to do most nights of the week. You're just putting it in the microwave for depending on the microwave, between 18 and 20 seconds. You're going to lay that gently across your wrist to make sure it's not too warm for your lids. Then you'll lay it across your eyelids for 10 minutes. And that will take some of those thickened oils that Austin was showing you earlier and start to help thin them out a little bit. And then once you take off the Brutta mask, if you give your eyes a good squeeze for 3 seconds and you open it up, sometimes your vision is blurry for a second or two, which is reason to celebrate, because that's an example of some of that thickened oil that's been expressed out of the gland.
Yep.
And it will just drain right out of your eye. You don't have much to do after that. And if you can do that on a regular basis and keep those oils moving along, that will help keep the inflammation down as well.
That's a great summary there. And we really like, Michael and I and the dry team, we really feel like if we can keep the patient involved in the process, so we'll do a lot of in-office therapy, but certainly if there's things we can do at home to prolong those effects, yeah, we want to make sure that we work as a team for that. So Brutta mask, nutritional supplements, all very helpful. I wanted to show you another example. Show some pictures of some myography scans of patients with reduced glands. Here's one who doesn't have any glands, unfortunately, but through regular IPL treatment, those glands are working really well. You can see not much glands here, and we have a nice smooth tear film. So it sure is a nice, effective treatment option that's now available for patients with advanced disease. This helps the tear quality part of it. Go back to the main screen there. So we talked about tear quality. Next one, we'll talk about tear quantity. And this goes to a lot, what a patient asked earlier about arthritis. I'll come to that in a minute. Let's say the patient has pretty good glands, good quantity, maybe a little bit of loss there, a little bit of shortening there. But more importantly, or in addition to, they also have low tear quality. So when we look at your eyes, we look at the quality of the tears. How well do they stay in the eyes? How quickly do they break up? We also look at the tear quantity. And ideally, this area here should be deeper. This is what we call our tear lake. And it should be deeper. Right now, it just looks like a little pencil line. We want it to almost be thicker, like a highlighter line. And this, unfortunately, this low tear lake can come along, go along in patients who have underlying systemic inflammation. Patient asked about arthritis. Unfortunately, that can do it as well. There's also other causes. I'll go over that in just a moment. When we have this low tear quantity, that causes a lot of inflammation on the eyes, which makes the eyes red and scratchy and burning. This can be due to many different causes, different health conditions, most commonly like diabetes, for example. It can be due to different eye surgeries, might affect the tear production. There's autoimmune conditions. Common ones we hear of are arthritis, Sjogren's syndrome, many times that goes along with dry mouth, dry eyes. Different medications, allergy medications, blood pressure, depression, just to name a few. So unfortunately, dry eyes is what we call multifactorial. There's a lot of factors that can cause dryness and decrease tear quantity. We talked about the quality. This is the quantity side of it. So what we try to do is we try to decrease the inflammation that goes along with this, either systemically, working with your doctor to make sure there's no underlying inflammation, but also through eye drops. These are some eye drops you may recognize if you can try. There's really good options out there. Sometimes insurance covers one better than the other, no problem. We always we have a great team that tries to find the right medicine for you that's covered by your insurance. This is where nutritional supplements come in, as we mentioned earlier. Also, there's immunomodulators that are ways to reduce inflammation on a long-term basis, maybe safer than a chronic steroid, but also decreases inflammation with the goal of increasing tear production. Some other additional therapy for patients who just don't have enough tears, we can actually use their own tears from their blood. when our tears are produced, they go through the lacrimal gland. The lacrimal gland pulls out the serum basically and makes our tears. Well, we just do it differently. We just bypass that and go out, have a patient do a blood draw. They spin out the tears that we need, and they come in bottles for the patients to use. It's called vital tears. That's a great way to help the tears. Also, there's pills that are helpful. And actually, more recently, there's another one called some neurostimulation, where either with a nasal spray that can shoot up your nose or into your nose, not up your nose, or something that stimulates the side of your nose. That stimulates the trigeminal nerve, which goes back to the brain, tells the brain to produce more tears. So it's really nice, as Michael mentioned earlier at the start of this discussion, that now we have good treatment options, which we didn't have before. And the challenge is to find which one works the best for you. And some patients, because they have different health conditions or different factors, might respond better to one than the other. It's a chronic condition, so there's chronic therapy needed. What we try to do is just in general decrease inflammation, improve the tear quantity. Once that's controlled, we can also do something called punctal plugs, where we just put a soft little plastic plug in your tear ducts. So we have tear ducts on the bottom, two on the bottom, two on the top. Many times we just plug up the bottom two, and that keeps the tears on the eyes longer. Ideally, it makes that tear lake deeper. Jumping into the questions here. Yeah, so Marty, good question. What drugs, if any, can make dry eyes worse? Beta blockers. So beta blockers is a common one that dries them out, whether it be oral or topical. One of my interests and specialties is glaucoma. And unfortunately, the glaucoma medications can make our eyes dry, like beta blockers can do that. We can also supplement, someone's asking, what's the best eye drop to use? Should be preservative-free. We can supplement all this treatment, with artificial tears. In addition, during the daytime. And we like to recommend, if you use artificial tears, make sure they're preservative-free. Some are more aqueous-based, so watery, if you have a low tear quantity. Some are more lipid-based, so more oily if you have low tear quality. And during the examination, we can assess that and find out which tear would be best for you, recommend one. There's dozens over the counter. And if we could find one that works best for you, that'd be our goal with it too. Anything I'm missing there, Michael? What else would you recommend there?
No, you're right on.
For patients with glaucoma, is it better to use pilocarpine than a beta blocker? Are you referring to pilocarpine drop? In the past, they used to use pilocarpine for glaucoma. It just doesn't work as well or for as long. A beta blocker would be better as far as lowering the eye pressure. However, having said that, working with Dr. Beffers, and this is what's great, we're able to use other treatments besides eye drops now to lower your eye pressure. So the best way to treat glaucoma is to lower your eye pressure, and we don't have to depend on eye drops as much. Like dry eyes, how we can do in-office therapy, there's in-office therapy for glaucoma. Either lasers, we can put the medicine in the front part of your eye. Dr. Beffers does a great job with some very simple, brief, effective glaucoma procedures, which helps the drain work better. So it's interesting. Sometimes the best way to treat glaucoma or treat dry eyes in patients who have glaucoma is for us to get you off your eye drops. And that helps improve it a lot. So that's a real helpful way to do that while still controlling the glaucoma without that worsening effect from the drops. So yeah, we generally don't use pilocarpine just because it's not as effective as the newer ones. And it causes a lot of side effects, brow ache. But I like the idea as far as oral pilocarpine, like you're thinking, I can see your thought process as a way to help increase production like that. So it's a great idea to use it. But nice thing is, I think we'd recommend probably switching therapy to something that works better and more sustainable.
Austin, we have a question from Barbara about using, I think, Pataday. My right eye is always dry. I use Pataday, which helps, but it continually remains dry. What else can we do?
Well, Barbara, and that's pretty common. And sometimes I assume you're probably using Pataday for allergies. And many times allergies, unfortunately, goes hand in hand with dry eyes. We don't have good tears to wash out the allergens. They stay on our eyes, more allergies like that. So Pataday is great if your symptoms are mainly itching, white ropey discharge, itching, and watering. But if there's something that's underlying dryness, what we want to do is do an evaluation and kind of see what type of dryness is it. Is it due to low tear quantity, or low tear quality, or both? Many times, using some anti-inflammatory medication over here, like I showed you, helps calm down the inflammation that goes along with allergies. Even the dryness helps it feel better. So as a simple, mild case, maybe try preservative-free artificial tears, gives your tears a boost. Pat a day once a day for allergies, it works great. But if it's still not where you want to be, you're still feeling it, there's other good treatments we can do, medications, cleaning, heating, treatment like that in the office. And that kind of goes along with some other issues here. So we talked about dry eyes can be due to low tear quality, low tear quantity. A couple other subsections here. Can also be due maybe to decreased blinking or eyelid closure. And I like this photo because you can kind of see the nice smooth surface up here. As we go further down, you start to see these little green spots. And these are little micro abrasions, little spots of dryness on the surface of our eye. When it's in that pattern, there could be an exposure component to it. The patient might have good tear quantity, good tear quality, but maybe the patient isn't closing their eyes all the way, either nighttime or during the daytime. Let me show you what I mean by that. So one way we'll do is part of the evaluation, we just put a little pen light on your eyelids. So we'll have you tilt your head back, act like you're sleeping, and we'll see if we can see any light sneaking through the bottom part here. If there's any light sneaking through that part, that suggests that maybe there's a little bit of exposure at nighttime. Your eyes are opening up some, so they might dry out some. This would show up in the morning time. So if someone tells us their eyes feel dry in the morning time or the middle of the night when they wake up, ideally that's when they should be feeling the best. But if you're feeling dry symptoms at that time, there's probably some sort of exposure component to it. Another condition that we see is just patients during the daytime, we may not blink all the way. So we might have a pretty good tear lake, moderate tear breakup time, so the tears are starting to break up. But look at this line right here. You see that line there? That's where the eyelid stopped its blink. So it wasn't a complete blink, it's what we call a partial blink. As a result, because this patient doesn't blink all the way all the time, this patient has this area of dryness down here. So one thing we tell our patients is make sure you try to take time to blink regularly. Every now and then just kind of close your eyes. Blinking regularly distributes these good tears across the eyes better. It squeezes out the oils from the glands better, and it helps prevent some of that dryness pattern that we see. Sometimes with that dryness, it's not due necessarily to eyelid closure, but maybe eyelid position. Here's a patient we saw not too long ago, and this is an interesting pattern. It looks pretty good down here, looks pretty good up here, but centrally in both eyes, pretty dense areas of dryness. This is because their eyelids, unfortunately, were rolled outward. They couldn't close them completely. As a result, we have what's called exposure keratitis. The surface is really dry. So sometimes if the tear, in fact, this patient's tear quality numbers were actually really good. It wasn't due to tear quality, quantity, more due to exposure. So this is what it looked like before we put a contact lens on. This is a medical fit contact lens that's safe to sleep in, and we let them sleep in it for a week. And so I'm back about a week later, and it showed some improvement, probably almost completely in the right eye and a little bit more in the left eye. And we can just do that as bridge therapy until the patient can have eyelid surgery to have those eyelids rolled back in so they're in better position. So sometimes our dry eye feelings can be more than just quantity and quality, it could be exposure component to it. Great, so let's see what questions we have there. Is Visine a good brand for dry eye drops? Michael, any comments on that?
The last few years, the ophthalmic community has released so many wonderful specific medications that something like Visine that was popular years ago and well marketed, it really doesn't have a long-lasting effect. And there's actually a component where the tachyphylaxis, it'll bounce back. The symptoms and irritation will bounce back after using the drop in short order, and sometimes even worse than before you used it. So it's not something we recommend because we do have so many targeted options available to us.
And we understand that, you go to the pharmacy and look for dry eye drops, it's a wall full. A wall full of eye drops, and who knows which type works the best. And For the dry evaluation, we try to find out which type of tear would be best for you. Nice thing is many times we have samples, which we can provide you with to let you try them as well. And artificial tears are great for maybe giving the tears a boost while we try to treat the underlying causes of quantity or quality or exposure. Good. So along the lines to the contact lens question, the question was, can a contact lens get lost or stuck in the eye when you have it in for that long? That's a really good question. And fortunately, the eye has kind of a natural barrier, so it won't get behind the eye. And these types of contact lenses, they've gotten better, just like the treatments have gotten better. They breathe better, they don't dry as quickly. And these contact lenses are indicated for sleep in, if you want to, up to a week or sometimes for a full month. We watch the patient carefully. There's always a small risk of developing an infection when someone wears a contact lens for a prolonged period of time. They usually use it artificial tears regularly and antibiotic if needed. But usually it doesn't cause any sort of complication. In fact, it's a very comfortable way to treat it. It'd be kind of like having a scratch on your hand, we put a Band-Aid on it. More comfortable healing, more quicker healing. Yep. I love these questions. This is so wonderful. So we kind of talked about decreased tear quality, decreased tear quantity, eyelid closure. Next one is, the final one is decreased eye surface health. And this will go along with what a patient asked about Fuchs dystrophy, but sometimes we have patients who have good eyelid closure, good tear quantity, good tear quality, but they still feel like there's something in their eye, kind of a gritty feeling. This is called conjunctival chalasis. So you can kind of see this whitish area down here. The white part of the eye is covered with the thin tissue called the conjunctiva. It'd be kind of like saran wrap, just really thin. Sometimes from aging changes, it gets a little bit looser, or from inflammation, chronic inflammation gets a little bit looser, and just kind of builds up down here at the bottom. Well, as you see in the slide over here with the dye, every time you blink, it affects the tear distribution. And the tears kind of settle down here, not so much on up there where we need it. So it could be, this component can also cause foreign body sensation, dry eyes. And working with Dr. Befrus, he also helps with that too. So it's good you to see Dr. Befrus, and you tighten up that conjunctival tissue so we have more smooth surface for the tears to go from. So that's on the conjunctiva. Also, you can have a type of corneal dystrophy. This is called epithelial basement membrane dystrophy. And if you look carefully, some parts of the cornea are nice and smooth. Some have these little micro ripples or ridges on the cornea. That's in the right eye or the right eye. Here's another eye. Sometimes it can be peripheral, sometimes around the center. And this would be kind of like if you had a bumpy windshield. If you have a bumpy windshield and you turn the windshield wipers, it just might not clean it as well or as easily or as comfortably. Same thing on the eye. This is like these little micro ripples or ridges. If they're dry, then that's more noticeable. So many times we use like an ointment at nighttime to help reduce that swelling, treat the daytime with good drops to reduce that frictional force, or we just might have to smooth it all out, put a special healing lens on, and let it all grow back evenly. This is epithelial basement membrane dystrophy. It's unrelated to Fuchs dystrophy, which a patient asked earlier, which wouldn't directly cause dryness. However, I do see a lot of patients who have Fuchs dystrophy who also have epithelial basement membrane dystrophy. So indirectly, it might be related to something like that. In other case, we're just trying to improve the surface, make it smooth for us. So many times these surface conditions can be treated with ointment, in-office procedure, artificial tears. And the question was asked, is Refresh eye drop still good for your eyes? It is, yeah. Refresh has some really great products. Omega-3 ones. There's preservative-free options. We really like Refresh and Sustain, TheraTears, Retain, Fresh Coat. There's a lot of good ones. Avisia. There's a lot of emphasis in dry eyes. You know, dry eyes, unfortunately, has become more and more prevalent. And if we can get some relief from artificial tears during the daytime, that's a great goal to have. So we try to get the surface smooth, whatever that may be, or the conjunctiva. Sometimes it's just so dry, and it's been so dry for so long, it causes these little filaments, little strands of microabrasions, or even like a little ulcer, unfortunately, where it's been too dry for too long, and it causes sensitive light, pain, redness. There's good ways to treat this. And I think if it's just exposure related and we had a contact lens, we get pretty good healing like that. If it's been there for a long time, there's underlying causes. Of course, we try to treat the underlying causes, but many times we might want to use what's called a procure lens. And many of you patients may have heard of this or even tried it before. It's basically like a contact lens, and it's a thick membrane. This thick membrane is held on by a soft plastic ring. So it's good because it keeps this membrane right in place, right over your cornea where we want it. And over time, 4 to 5 days, 5 to 6 days, this membrane gradually resolves or dissolves onto the cornea, and miraculously, it heals it really well. We're getting great results with this. So we can have patients that look like this, put a Procare lens on, and it looks like that in 5 days. That's a big improvement. It has special human growth factors that are also anti-inflammatory and antimicrobial, so it helps prevent infection, control scarring, and facilitates growth. So both are good options for advanced dry eyes. Procare sure is a great option for that as well. How are we doing on questions, Michael?
Okay, we need to address, is the dystrophy painful?
Yes and no. If it's just mild dystrophy, and the surface isn't too irregular, too dry, patients may not have any symptoms. Sometimes it's found coincidentally on the exam. If it's significant and the eye is really dry, it can cause little micro erosions, like having a corneal abrasion, unfortunately. And when that happens, it's like having a scratch in the eye, so it can be pretty painful. That's part of the healing process, is we try to maybe use a Procare to help it grow back evenly and more securely. And the next question, kind of related to that, is scar tissue on the cornea can be treated with drops. The body heals by scarring, and anywhere else it's okay, it's fine. But if there's scarring on the eye, it affects the cornea, which can affect the vision. So in the eye, we don't want the scarring. We try to control the scarring by maybe using a steroid. That helps control the scarring. But the other thing we like is using this Procare lens, because that really controls the scarring as well, nicely. So it helps not only prevent healing, prevents infection, but it controls the scarring. And it gives us a good, clear, smooth surface once we're all done, like it shows there. A good question that I forgot to answer earlier. The question is IPL and red light therapy covered by insurance currently? And that's a great question. We have really great procedures that are available nowadays, which we didn't have just a few years ago. And there's good science behind it. These procedures don't hurt. There's no restrictions. The patients have great results with them. Unfortunately, it's still a non-covered procedure. I mean, insurance doesn't pay for it yet. Now, a lot of times patients might use their health savings account, for example, or deduct it from their taxes in a year on their medical insurance, but it's still a non-covered procedure. We know that it's a big investment to make for these procedures, but we feel like it's a great way to get the best benefit and get you feeling better the quickest. So it's we try all different options, of course, but if it's a non-covered procedure, we work with you and try to find a way we can make it work for your situation and get you feeling better. And the contact lenses I did talk about, so these contact lenses, both of them are covered by insurance. So if a patient needs just a regular medical Advantage contact lens, that's covered by your insurance. If they need a special Procare lens, that's also covered by insurance. So there's a lot of good therapies that are covered by insurance. Excuse me. Hey, Aaron, can you give me a drink of water? I guess my mouth is feeling a little dry from us talking about dry eyes, so I get a little water here. So even though there's a lot of procedures that we can do in the office that help the patient, just some are not covered by insurance, others are covered by insurance. So that sure is helpful for patient access like that. Good. So we'll go back to this one here. So we're kind of nearing the end of our goals here. We talked about decreased tear quality, quantity, eyelid closure, eye health. All these can lead to decreased comfort, vision, and quality of life. So our goal is, as a dry eye team, with all of us, is however possible to improve that tear quality. Okay, we'll have to edit that part out if we keep this recording, Michael. So improve tear quality. That's our goal. Improve the tear quality by helping keep the eyelashes clean. Use the light therapy to open up the glands. We clean them up, we heat them up. And then we pair that with your good efforts at home, using a brooder mask, for example, nutritional supplements. We try to improve the tear quantity by reducing inflammation, using immunomodulators, ocular nutrition, controlling your systemic and ocular conditions, doing switch therapy for glaucoma if that's needed, also doing punctal plugs, neurostimulation. We talk about blinking. And I think one of the things we do is I have this triad treatment that we recommend to patients. We're going to do a brooder mask pretty regularly, a heat mask at nighttime or during the day. We're going to make sure you use nutritional supplements and make sure you blink regularly. And this is especially important for patients who do a lot of computer work or reading. You know, that's our world. We're really focusing, so we're not blinking as much. And the longer we do that, the more it dries out. So if the symptoms are more towards the end of the day, it could just be simply a blinking issue. So the eyes need that restoration, that healing property every time we blink, and especially so at nighttime, it needs to be completely closed to help it heal. And then we try to improve the ocular surface health by special contact lenses, Procare lenses, surgeries as needed. And our goal is that hopefully through all this process and over time that we can improve your ocular comfort, your vision, and your quality of life. And as many of you know with dry eyes that it's a chronic condition, and you know, you've had it for a long time, we'll always have it. But it's important that as we work together that we keep an open mind and we try to stay positive, as there's a lot of great options out there and each person is different, as we work together to improve that, those symptoms for you, addressing each step as needed. All right. Does eye makeup affect dry eye? Yes. Yep, you're right. That's very helpful. We talked about keeping the lashes clean. Well, sometimes the makeup, of course, can have some buildup along the lashes. So if it's not removed properly, even more, sometimes the makeup itself has some chemicals or ingredients that can cause low-grade inflammation on the eyelids. Low-grade inflammation clogs the glands. Clogged glands produce less tears, so lower tear quality. We talked about home therapy, like using a brooder mask. And the question is there a difference between a brooder mask and a rice mask? And there is a difference in that it's in the quality, the distribution of the heat, more of a moist heat with a brooder mask. We like the brooder mask, and there's other ones out there that you can get online that might be electronic or so forth. But the brooder mask is nice because it's relatively inexpensive, it's reusable, it's safe, you can wash it. Unlike a rice mask, you might not get the right temperature at the right time. It's not as predictable. Anything you want to say about that, Michael, about rice mask versus brooder mask?
Sure. The brooder mask and masks similar to brooder mask have a consistency to them of temperature. So the melt point for the thickened mebum needs to be 4 or 5 degrees warmer than your body temperature. And a brooder mask can hold that temperature for up to 10 minutes. Whereas some of the earlier treatments, a hot washcloth or race sock, they can't sustain a consistent temperature above your body temperature to make that mebum change, especially on a monosaturated oil. So it is significantly more precise. It travels humidity with it, so wet heat will always work better than dry heat. And they have small little angstrom openings in the medical beads, which are covered with silver nitrate, so it's antimicrobial. So it transfers the heat in a moist way versus just a dry way. And as Austin said, it's reusable, and it usually lasts for a year. And if it comes up a little bit short, that's okay. It's not that expensive. It may sell for $25 to $30.
Yeah, and a lot of patients find it relaxing. I think that's the important part. The nice thing about it is it forces us to keep our eyes closed too. Sometimes just having that break, keeping the eyes closed, helps for us.
And if you do use the brooder mask, I'm sorry to interrupt, Austin. It's great once you take it off after the 10 minutes. if you could give your eyes for a good 3 seconds, a good hard squeeze, as we mentioned earlier, to help evacuate out some of that more resistant oil that was in the glands. You'll notice it, the vision might be a little blurry for a second or two, and you might have to blink it away, but it's incredibly helpful once it's warmed up to then usher out some of that sebum, that oil.
Yep, that's a great point. And I apologize, I didn't put a picture of a Brooder mask here. One of the attendees is asking what a Brooder mask is. Brooder is just a brand. I guess it's from, did Brooder invent it, Michael? Maybe that's what it was.
Yeah, actually they used,
that's a brand.
It was a gentleman, Mark Brooder.
There we go.
Who made it for the back.
Oh, okay.
Wet heat for the back. And actually it was a physician who was wearing it on his back, who had a sinus issue, who took it, folded it, and laid it on his face. And then after doing that for a few days, his dry eyes started to feel better.
Oh, interesting. That's
and they talked to the owner of the company, and the engineers started to refine the shape so it would fit on the face comfortably.
There you have it, the history of the Brooder mask. And it's B-R-U-D-E-R, Brooder mask. Yep. So you can get online, you can get in the office. It's really a great way to help complement what we do in the office with your home therapy. And back to the makeup, there's different types of makeups out there, and there's a list of ingredients. If you want to start by the office sometime, we have a list of them. There's one called Eyes Are the Story, which is more safe, more gentle on our eyelids. Eyes Are the Story, that's the type of makeup line that we like as well.
And that was developed by a group of doctors who for years were frustrated because some of the ingredients in a lot of the large manufacturers were counterproductive to the health of the glands. Mm-hmm. And they were having a hard time finding places that would make their chemistry. But the ingredients, and you can always tell if you see the word, a part of the word has P-R-O-S-T in it, it's probably not ideal for your glands. And there's a significant amount of ingredients in some of these formularies of makeups. And just look for the P-R-O-S-T as part of the word, and that should give you caution because there are parabens, formaldehyde, paraffins, alcohol, fragrances, and a lot of these makeups, which are all counterproductive to the health of the eye. And as Austin mentioned, Eyes Are the Story takes great pains to make sure they're not involved in their chemistry.
Another question was how often should we use artificial tears or eye drops? And I think one of the things that Michael and I like about dry eyes is each person's different. The causes are different, the treatments are different. For some patients, maybe just a couple of times a day is all they need. For some patients, there's therapy that helps regenerate the nerves. You might have to do it every couple hours while you're awake or every hour while you're awake. And there's a lot of great options out there now where patients can have an improved tear quantity that improves surface health if they take the right eye drop, the right frequency, the right time. So just to review, and we'll come back to some questions as well, but I just wanted to go back to what we talked about. Michael and I feel like as part of the dry eye team that if we can make sure we understand better how your glands are working between us, we can get a better plan to help you feel better and help give us better tear quality. So next time you have your dry evaluation, just mention this code GlandScan. We'll give you a complimentary gland scan of your myography. I think it's fun to see what we have, where we can work with, and work together. The other thing is because each of you have joined on tonight, we really appreciate you taking your time in your schedule. Really appreciate Danielle and our administrative team to helping create this webinar. Michael for joining on. I'm just grateful for the team. It's definitely a team effort, as we say, it's dry eyes in all of us. But one of our goals was to reward you for your time. We wanted to provide complimentary to 3 people this red mask therapy. It's called photobiomodulation. And like we showed earlier, we just put this mask on, heats of the glands tries to jumpstart what we're trying to do. So I'm just going to go ahead and choose some numbers here. I have my special eye hat, my eyeball to pull out there. So I'm going to pull something out at random. Now I'm looking at my attendee list right here. Okay. Pull up. So Barbara Bonner. Michael, do you mind writing this down? she's number 3. So I got number 3, Barbara Bonner. That's on my list there. So I'm up here. I think I was a little ambitious. I had 98. A little hopeful here. Okay, let's see what else I have. Good. And number 19. Let's see what I have there. 3, 6. Yep. So it looks like Marty. I just have Marty is number 19. Marty, if you could contact us about that one. It's a free, big winnings here, $300 value. The next one's number 11. And I'm gonna have to count all the way up here. I'm sorry, it's not 3, 6. And it looks like Gail Johnson. Okay, so Gail Johnson. So each of you have won a free photobiomodulation low-level light therapy session with Michael or one of our team members. We're excited to do that for you. It would be great to have you in for the evaluation, do the biography, see what it has, and see how this can help you for that as well. So please make sure you reach out. We'd love to help involve you in that clinic and have that experience. The nice thing about it is, as you're with Michael, the others, it's not just a treatment, but it's more of an experience as well, that we're trying to make sure that you leave not only feeling better, but with educated and learning the latest things that we're learning as well. Let's see, there's any other questions? And then Michael, I'd like to see if you have any closing thoughts for us. You guys have been so great. Thanks for joining in. Loved all the questions. And what's a good product to take makeup off? Unfortunately, I'm not a specialist on makeup. So Michael, any comments there?
Micellar water is becoming more common and does a very effective job.
Micellar water, thank you.
Yep.
Good. Michael, what closing comments do you have? Anything you want to leave as we've talked about quantity, quality, treatments?
I think 2 thoughts, almost in a bumper sticker form. You can manage dry eye. If not, dry eye can manage you. So I think for a while, people had an occasional flare-up of dry eye and didn't pay that much attention to it. And then over time, they would self-medicate logically by going to the pharmacist and taking a wall of artificial tears and trying 1 or 2 of them. And that may have suppressed some of their frustration for a little bit, but it reoccurred. And then by the time they go see their doctor, if their doctor doesn't specialize in ocular surface and dry eye, they might just get a generic therapy. And then by the time a specialist in ocular surface and dry eye, like Dr. Lifferth, sees you, there's been a little bit damage down the road. And it's easier to treat these patients as early as we can. We have many more options and the success rate is much higher. So part of our passionate mission is just what Dr. Lifferth said. When you're in our office, we spend a painstaking amount of time educating the patient so they can participate in the decision-making process. We do that with doctors who come in on a regular basis and get education from us for the same reason, so they can help their patients make educated decisions. But that's when the patient comes in or a doctor comes and visits. I think Dr. Lifferth did such a great job at creating a vehicle to reach out to patients who aren't necessarily in our office all the time. And this should be the first of many of educational opportunities to help just increase awareness and help patients understand that some of the symptoms that they may have, and some of the patients don't have symptoms yet, and it's always difficult to tell a patient there's a problem going on when they feel fine, because we see clinical signs that are a harbinger of some challenging things to come. If we can keep the educational process outside our office as well as inside our office, I think we're going to have much happier patients because we can get to them earlier. So congratulations on a wonderful opportunity to help patient education tonight, Dr. Lifferth.
Well, thank you, Michael, for joining in. And thanks again to each of you. I think as you participate in this dry care, as we work together, we basically try to tell a story with your symptoms, with your clinical findings, and we kind of write that story together and come up with the ending together of how we're trying to improve it. And we know it, we certainly know it takes time, it takes some patience and effort, and it can be challenging, but we're hopeful now. We have good treatment options. We can diagnose it earlier and better ways to improve it. So thank you to each of you. I think I have one more question coming up. Let me see what else it shows here. Actually, I think we got them all. So thank you to each of you for joining in. I know it's been a little bit longer than planned, but I sure enjoyed it. I've learned a lot. And if you have any other questions, feel free to reach out to Michael or myself, any one of our team members. My email address is austin@caringforeyes.com. And Michael's is M Major, Michael M Major @caringforeyes.com. We'd love to hear from you if we can answer any questions. We'd love to see you or your friends or colleagues in as well for any evaluation. I think I got most of the questions. Michael, was there anything else you saw that I missed there?
I think you did a great job covering them.
Michael, what's the name of that makeup remover?
Micellar water. It's there's several manufacturers of it.
Micellar water. Good.
Yeah.
Good. Thank you. Okay. Well, thank you to each of you. Hopefully, we answered all the questions. Just going back through here, you guys did great. These are very insightful and very helpful. Okay. Well, until next time, thank you for coming in today and or virtually coming in today. And it's great talking with each of you. Thanks for your questions. Have a great night, and we hope to see you soon.
Thank you.
Have a great night.